Hi, I'm Dr. Yeshwant Mane, practicing IVF specialist at Atharva Infertility Centre since last 15 years. Today we'll be discussing upon a commonly encountered problem, what is ectopic pregnancy? Now all of you know the normal pregnancy happens in the uterine cavity or the uterus. So any pregnancy outside the uterus is defined as ectopic pregnancy. Ectopic pregnancy can occur in different parts or different organs, especially the fallopian tubes, the ovary, abdomen, or it could be even cervical ectopic pregnancy. But the most common form of ectopic pregnancy is tubal ectopic pregnancy. Now, if you see the normal anatomy of the uterus is surrounded by two tubes, the right and the left, and the right and the left ovary. Now, if you consider the normal physiology, with each menstrual cycle, around about 14th day of the cycle, an egg is produced in the ovary. When the egg is produced in the ovary, it ruptures and the femoral part of the fallopian tube captures the egg. When the female have a intercourse, the sperms are deposited in the vagina, the sperms ascending into the uterine cavity, and they reach the ampullary portion of the fallopian tube. So, from the lateral part, the egg is captured into the fallopian tube, and from the medial part the sperms migrate to the ampullary part of the fallopian tube. Now this is the portion of the fallopian tube where the egg fertilizes with the sperm. Now as soon as the egg fertilizes with the sperm, it forms a zygote and it develops into an embryo. Now it cleaves at every 24 hours interval into 2 cell, 4 cell, 8 cell and a 16 cell embryo. So embryo size increases, but this is not the place for the embryo to grow further. So the embryo migrates back into the uterine cavity and it gets implanted into the uterus. But because of some diseases or some pathology in the fallopian tube, the embryo fails to migrate back into the uterine cavity. Now, what are the pathological factors which hamper the migration of the embryo back into the uterus? The most common factor is infection. Of all the infections, the most commonly encountered infection, especially in India, is tuberculosis. The second most infection is chlamydia and other type of pelvic infections. So these infections, they damage the ciliary movement of the fallopian tube. So the embryo gets stuck into the ampullary or the ischemic portion of the fallopian tube and it tends to grow. So the patient usually has a history of amenorrhea, like missed period, her urine test is positive, but she has certain very peculiar complaints upon presenting at the clinic. Like she has pain in the iliac fossa depending upon which side of the fallopian tube is affected, either the right or the left, and she may have some amount of spotting. In some extreme cases, the patient may present with features of shock, the patient could be brought collapsed, and patient may have severe anemia also, with hemodynamic changes like increased pulse rate and decrease in blood pressure. If you do ultrasound, you can definitely locate the ectopic sac or the ectopic pregnancy on which side. If it is an unruptured ectopic, you can see even the yolk sac or the cardiac activity if it is diagnosed a bit later. So what are the management options available for ectopic pregnancy? First, you need to understand the pathology which is responsible for causation of ectopic pregnancy. The ampullary portion of the tube is the most commonly affected part of the fallopian tube. Now, the ampullary portion, the cilia of the tubal lining or the inner lining of the fallopian tube is permanently damaged because of some infection. So that tube is totally damaged. So different modalities of treatment, it could be a medical management or surgical management. Medical management involves giving certain injections like methotrexate, and it helps in drying up the ectopic pregnancy. Medical management, definitely it helps in curing that part of the pregnancy. But as I have said previously, the fallopian tubes are badly damaged. So there are repeat possibility that she may have ectopic pregnancy in the same fallopian tube at a later date. So we at Atharva Infertility Centre, we usually advocate laparoscopic removal of the fallopian tube. It is called as laparoscopic self-injectomy, because that tube is diseased or pathological, so that tube needs to be removed. In the same laparoscopy setting, we analyze the other tube. If it is found healthy, well and fine. If the other tube is found to have a hydrosalpinx or badly damaged tube, we advise laparoscopic cornwall clipping or resection. And the patient definitely can conceive with IVF at a later part. So, patients should understand that removal of the tube will not make them totally infertile or incapacitated to have pregnancy by any other form of medical treatment. If the patient is advised to remove a tube and the other tube appears to be normal, she can still conceive even with a normal single patent tube. So patients need to be counseled accordingly and try to explain them with advantages and disadvantages of keeping the contralateral tube.